Key questions about the mistakes and confusion that delayed the £150 million Sick Kids Hospital in Edinburgh remain unanswered, the country's spending watchdog has said. Auditor General for Scotland Caroline Gardner said a series of reviews into the fiasco had yet to establish why a critical specification was muddled and why no one spotted the error. The last-minute discovery of the flaw in the critical care ventilation system led to Health Secretary Jeane Freeman cancelling the opening of the hospital at 5 days' notice in July. There is now expected to be a year's delay and £16 million of remedial works. Ms. Freeman later announced a public inquiry into the construction of the sick kids in the troubled Queen Elizabeth University Hospital, QEUH, in Glasgow. Ms. Gardner says the problems in Edinburgh raise issues about the contractors involved, including Brookfield Multiplex, who also built the £842 million QEUH. NHS Greater Glasgow and Clyde yesterday announced legal action against the firm over the super hospital, where 2 children have died from suspected water contamination. Ms. Gardner makes the problems at the Royal Hospital for Children and Young People, RHCP, in Edinburgh the focus of her 2018-19 audit report into NHS Lothian. The Health Board had been planning a new sick kids hospital for the capital since 2008 and signed off its final business case in April 2015. The £230 million price tag included £150 million construction costs for the RHCP and adjoining Department of Clinical Neurosciences, plus £80 million for other infrastructure works. NHS Lothian appointed Integrated Health Services Lothian Limited, IHSL, to design, build, finance and maintain the project. IHSL comprised Macquarie Capital and Dalmore along with their contractors, Brookfield Multiplex, Bourget Energies and Services and HCP Management Services Limited. The key problem was an error in a document called the Environmental Matrix, which was produced by NHS Lothian at the tender stage in 2012. This should have said all the ventilation systems in the critical care part of the hospital must change the air hour 10 times per hour to help prevent infection. However, it included a reference to 4 air changes an hour for some areas. The document was changed in November 2015, but only added to the confusion. In February 2019, the hospital was handed over to NHS Lothian, which began paying IHSL a regular monthly fee of £1.35 million. The RHCP was due to open on July 9, but on June 18, the Institute of Occupational Medicine, which had been testing the ventilation systems, found air change rates were inadequate in operating theatres, isolation areas and critical care. On July 1, IHSL and Brookfield Multiplex told the hospital programme board that the critical care ventilation system could not deliver 10 air changes per hour. The NHS Lothian BOA. For more on this story, visit the news article link.